The Republican president who preceded the former president awarded Dr. Anthony Fauci the Presidential Medal of Freedom. Trump, more than a decade later, turned Dr. Anthony Fauci into something of a lightning rod for COVID culture wars and right-wing disinformation about a raging pandemic. Now, much of the energy in the fight to vaccinate the country is devoted to combating that disinformation from the former guy, as well as vaccine hesitancy. The reason many experts believe we will not reach herd immunity as a country. Political affiliation is an undeniable influence in the decisions people are making about whether or not to get vaccinated. According to the Washington Post, here are the top 21 states where the highest percentage of people have been partially or fully vaccinated. All of them happen to be states that President Joe Biden won in 2020. And here are the 17 states with the lowest number of adults at least partially vaccinated. All of them, except for Georgia, were won by Donald Trump. And somewhere in the middle is Iowa, also won by Trump, where demand for the vaccine continues to decline. The state turned down more than 75,000 doses from the federal government for the week of May 10th. Joining our conversation is Dr. Anthony Fauci, director of the National Institute of Allergy and Infectious Diseases, as well as chief medical advisor to the current president, President Joe Biden. Thank you for spending some time with us today.
Thank you for having me. Good to be with you.
So if the scientists have done their part, and this president and his administration have done their part by upping production and distribution, how do you solve that political piece of vaccine disinformation and hesitancy?
Well, it really is a significant issue because the solution to the problem of getting us back to normal and getting the number of cases down to a very low level is vaccination. And it seems almost paradoxical that the people who are saying that they want to get back to normal and that the restrictions that the public health community is putting on them is preventing them from getting back to normal. And the easiest way to do it is to get vaccinated. So we really have to outreach in a non-confrontative, non-pejorative way to the people who are hesitant to get vaccinated and try to get trusted messages, people that they trust. They could be anything from a sports figure to an entertainment figure to a clergy person, to their family doctor. And I think when you start breaking it down into political ideology for a reason to or to not get vaccinated, that's just so contra to the concept of public health. Because, I'm saying things that are obvious, that public health is not a political issue. Public health is what affects all of us. And that was really one of the issues that's been so troublesome, is that we've been through and still are going through a historic pandemic in the midst of and in the context of extreme divisiveness in our country, which is really unfortunate because we should all be pulling together in this the same way you do when you are at war. You don't want to push that metaphor too far, but it is like a war, and we have a common enemy. And the common enemy is the virus. The common enemy is not each other. So if we could put that behind us and realize that the solution really is a vaccine, no doubt about it. Historically, with other diseases and with this particular disease itself, we have a highly efficacious and safe vaccines, plural, more than one. And we're fortunate enough in this country that we have a supply of vaccines where we can literally vaccinate everybody in the country. So that's the reason why we really need to do whatever we can to win over people who are hesitant, to get them to realize it's important for themselves, their own health, it's important for their family, but it also is almost a societal responsibility to be part of the solution ending the outbreak.
Donald Trump and Melania Trump are vaccinated, and Donald Trump was much sicker with COVID than anyone in the public knew. Would it help if he taped some public service announcements speaking directly to his supporters who make up that largest chunk of Americans who are saying, at least today, that they won't get vaccinated?
Well, I'm certain that, he has a large, very, very loyal following. I'm sure that would have an impact. But our approach is not to rely on that, but to appeal, to the reason and the rationale of people, and to get the messengers that they trust. And if you put aside political ideology, because there's another side of everybody besides their political affiliation. And I believe that if we get those community people that they can relate to, that they trust, and even their family doctors, and I think that's something that's being underplayed in this. Most people, if their family doctor that they've trusted for a long time, that's taken care of their entire family, says, it really is a very good idea to get vaccinated to protect yourself and your family, I believe you'll be seeing a lot more people coming over to the other side and saying, why not? Forget about political affiliation. Let's just get vaccinated.
For a fleeting time, one of the more united periods after a tragedy was that short window after 9/11. I worked for George W. Bush then. I know you did as well on very different issues. But the threat was a domestic terror threat. But the message that every American took in was, if you see something, say something, especially in New York. And that was about doing your part, I guess, to warn of anything weird at an airport or at any sort of public space. Is it time to turn the vaccination message into, real men protect their churches, real men protect their kids, real men protect their communities? Is it time to turn it to a stop the transmission message, not a protect your health message?
Well, I think you hit the nail on the head right there. And that's what I have been talking about more frequently of late. And let me explain, Nicole, what I mean, because it's really an important issue. A significant proportion of the people who don't want to get vaccinated are young people. And they say to themselves, for any of a number of reasons, I don't want to get vaccinated. And besides, statistically, and they're correct in that, they're not incorrect. Statistically, if you are young and healthy and you get infected, the chances are, maybe 40% that you won't even get any symptoms. And if you do, they likely will be mild. Occasionally, be careful, occasionally, young people really do get very sick and actually get hospitalized and die. So you're not completely protected. But for the most part, from a statistical evaluation, the chances are you're not going to get into a lot of trouble. So people like that would often say, well, then to heck with it, let me get infected and do whatever the heck I want to do and not restrict my freedom, as it were. The only thing wrong with that dialogue is that means you're looking at yourself in a vacuum. Is, well, if I get infected, it's not going to impact anybody else. And that's completely incorrect, because if you get infected as a healthy young person and you have no symptoms, it is likely that you will inadvertently, and I will say even innocently, infect someone else, who then might infect someone else who really might get very sick. So if you want to be part of the solution to ending the dynamics of the outbreak, and take not just a personal look at it, but take a societal responsibility to say, I don't want to be part of the chain of transmission to somebody else. I want the virus to stop when it gets to me and not infect me and make me an instrument of its spread. So even if you don't get any symptoms, you can actually be an instrument of the spread of the virus. So when you look at it like that, you can say, I really do have a societal responsibility. We're all in it together. The same way when President George W. Bush, who we both knew well and admired so much, went down to New York City and said, we're all in this together. We're going to get out of this together. That's really what we should be talking about.
Well, and those sentiments are fleeting. I think people also are confused about what the goal is. Can you clarify? Is the goal herd mentality, and what does that mean in a country our size?
I think we should just forget about that.
Herd immunity.
You're slipping. when sorry.
I've slipped.
Couldn't help myself. So I have been encouraging people of late to really not focus on that elusive terminology. If you just give me a few seconds, I'll explain it. The concept of herd immunity is when you get a number of people vaccinated, plus the people who have been infected, recovered, and are now protected, that you get so many of them that you get a veil or a blanket of protection where when the virus gets into the society, it has no place to go. It has no place to infect anybody. There are still people who are vulnerable, but it's very difficult for the virus to find them. That's what herd immunity is. The herd immunity threshold is a percentage of what percentage of the population needs to be protected in order to get this blanket of full protection. The fact is, Nicole, we don't know what that number is for SARS-CoV-2. We know what it is for measles because we've been dealing with measles for decades and decades. So rather than focusing on this elusive threshold of herd immunity, what we've been saying and what President Biden said this afternoon was let's aim for 70% of the population to get at least one dose by the 4th of July. That is a doable goal. It's challenging. It's not going to be easy, but we can do it. So what I've been saying is instead of worrying about we're not going to get to this elusive number, let's get as many people vaccinated as quickly as we possibly can. And the one thing that I will guarantee, because we know this as a fact, not as a hypothesis, but as a fact, that the more people you get vaccinated, the more and more the infection rate is going to go down. We've seen that with other infections, and we've seen that with other countries. I mean, I gave a press conference a week or so ago where we showed the data from Israel is that as the vaccination numbers went up, the infections came right down. So that's what we want to do. We want to do as many people vaccinated as we possibly can and not focus on an elusive number that nobody even knows what that number is.
You've been so generous with your time. Before I let you go, how are you doing? Do you have a pep in your step now that you don't have to stand behind Donald Trump when he tells people to inject bleach?
Well, I'm actually feeling fine. I mean, it's a big challenge when you focus on the enormity of this problem. You really get adrenaline levels that are very, very high, and you just keep going. So this will end, I promise you. And when it does, then I'll just go down. Just relax, have a beer.
Take a nap, read a book.
Yeah, exactly.
Hey, thanks for watching our YouTube channel. You should know that you can follow today's top stories and breaking news and catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.